Now, next month, India will be announcing, the union budget. This is the first after the pandemic. Are you expecting some policy response in terms of, higher allocation to healthcare in the budget? Focus on the primary healthcare, or any learning that we can pick up from the Southeast Asian countries?
So I certainly hope so, and I've heard the finance minister say that health is going to be a priority in this budget. I think it has to be. But we have to remember that these things are long-term and sustained investments, that things will not change that dramatically in 1 year or 2 years. And I have been particularly impressed with my visit to Thailand, for example, where I went from the tertiary hospital in the city. It was a district hospital, very well equipped, down, level by level, all the way down to the village, where I saw the kind of healthcare that people were getting, peritoneal dialysis at home, etc. So I think it's been 30 years that Thailand has been building on this, and they took a very conscious decision. At one time, it was a political decision to invest in primary healthcare, and they stopped building tertiary hospitals for some time because, when you have limited resources, you have to actually choose where you put your resources. And they decided that investment in primary healthcare is going to pay off more in the long run than building a few more big hospitals in the cities. Over time, of course, then you balance it out. But without primary care, it's going to be very difficult to solve any of the health issues that we have. And so I think the whole focus of Ayushman Bharat on one side is on the financial protection by providing that insurance coverage to the poorest 500 million. But on the other side, it is explicit that there will be investment in primary healthcare through these health and wellness centers that are linked to the primary healthcare centers, each of which will be staffed by either a nurse or an equivalent, a professional who can provide those primary services. And I think now using a digital backbone, we can actually do a lot. We can do a lot, and I think the private sector can play a role here. But I do think that the governance of all of this needs to rest with the government, and that people there needs to be a framework under which all the different players are actually operating, and it's very clear. The data flow is also very important. So we need a unified system where data on health can be collected. It ultimately needs to help the person. So they own their own health data, needs to be interoperable and so on. But there also need to be ways where the government can use that data in order to improve in order to focus and prioritize their investments.